हाय फ्रेंड्स, वेलकम टू क्लासेस बाय लैब डॉक्टर। आज के क्लास में हम बिलिरुबिन इन द यूरिन के बारे में जानेंगे। सो व्हेन यू सी अ यूरिन रूटीन माइक्रोस्कोपी रिपोर्ट, द बिलिरुबिन इन द यूरिन इज यूजुअली नेगेटिव। सो दिस बिलिरुबिनुरिया का मतलब ये है that there is bilirubin in this sample of urine. And what is bilirubin? Bilirubin is nothing but it is a breakdown metabolite of hemoglobin. So whenever in a healthy individual अगर उसका liver ठीक है, उसका bile duct anatomy ठीक है, then हमको bilirubin urine में we should not be able to detect. But suppose in case we find bilirubin in the urine, it we usually suggest that there is some amount of conjugated hyperbilirubinemia, and that is what causing bilirubin in the urine, which is usually a sign of liver disease or biliary disease. So before we understand the bilirubin in the urine, we will let's just brush up the बिलिरुबिन मेटाबॉलिज्म। सो आपको पता है जो हीमोग्लोबिन रहता है, इट इज मेड अप ऑफ हीम एंड ग्लोबिन, एंड व्हेन दिस इज डिग्रेडेड, ग्लोबिन इज एन अमाइनो एसिड, सो हम उसको ऐसे ही वी कैन नॉट लूज इट, सो ये यूज होता है, अमाइनो एसिड पूल में जाता है। जो हीम रहता है इन द रेटिकुलो एंडोथेलियल सिस्टम, इट इज ब्रोकन इनटू आयरन एंड प्रोटोफॉर्फायरिन। सो दिस प्रोटोफॉर्फायरिन gets converted to biliverdin, and this biliverdin will be converted into unconjugated bilirubin with the help of bilirubin reductase. अनकॉन्जुगेटेड मतलब दिस बिलिरुबिन इज नॉट सॉल्युबल इन वाटर, ये पानी में डिसॉल्व नहीं हो सकता, एंड व्हेन इट इज नॉट सॉल्युबल इन वाटर, ये it cannot travel in the urine. So what happens, this unconjugated bilirubin will bind to albumin, and ये इसके मदद से this will enter the liver. In the liver, this unconjugated bilirubin को liver क्या करता है, conjugated bilirubin बनाता है, मतलब it makes it water soluble बनाता है. Conjugated bilirubin is soluble in the water. So when this bilirubin, conjugated bilirubin enters the small intestine, what happens in the small intestine, this conjugated bilirubin will be converted into urobilin or urobilinogen, which will give the urine the yellowish color, and also it will be converted into stercobilinogen, which will give the stool the yellowish brown color. Majority of this is reabsorbed, but a part of it जो रहेगा वो excrete हो जाएगा in the form of urobilin and urobilinogen in the stool and as well as in the urine respectively. There is a overproduction of bilirubin, that is called, that time it leads to unconjugated hyperbilirubinemia. अगर समझो पेशेंट को एक हीमोलाइटिक डिसीज है, सो ज्यादा आरबीसीज डिस्ट्रॉय हो रहे हैं, ज्यादा बिलिरुबिन फॉर्म हो रहा है, सो दैट इज द कॉज ऑफ अनकॉन्जुगेटेड हाइपरबिलिरुबिनेमिया. दैट इज either because of overproduction of bilirubin or impaired uptake. लिवर में ही कोई प्रॉब्लम है, that is why liver is not able to take that bilirubin. So that is unconjugated hyperbilirubinemia or prehepatic causes of hyperbilirubinemia. Then the hepatic causes is there is some problem in the liver. Either the liver is not able to metabolize that bilirubin, or there is decreased excretion from the liver. That is what is called as hepatic cause of hyperbilirubinemia. So and later whenever there is either an obstruction, suppose यहाँ पे कोई obstruction है, तो उसके वजह से there is a decreased excretion of this bilirubin, that is what is called as post hepatic hyperbilirubinemia. So this could be because of a gallstone, because of a carcinoma in the head of the pancreas, etc. So this causes conjugated hyperbilirubinemia. सो ये कॉन्जुगेटेड हाइपरबिलिरुबिनेमिया मतलब ये जो बिलिरुबिन है ये वाटर में सॉल्युबल है, लिवर ने इसको सॉल्युबल बना दिया है, दैट इज व्हाई अभी ये यहाँ पे आ गया है कॉन्जुगेटेड के फॉर्म से, बिकॉज ये वाटर सॉल्युबल है. अनकॉन्जुगेटेड, ये लिवर से आने से पहले जो बिलिरुबिन रहेगा वो अनकॉन्जुगेटेड रहेगा, जो वाटर में सॉल्युबल नहीं रहता है. सो व्हाट इज द डिफरेंस बिटवीन कॉन्जुगेटेड एंड अनकॉन्जुगेटेड बिलिरुबिन? व्हाटएवर इज वाटर सॉल्युबल, दैट इज व्हाट इज कॉल्ड as conjugated bilirubin. दिस बिलिरुबिन जो रहेगा इट कैनॉट क्रॉस द ब्लड ब्रेन बैरियर, क्योंकि ये ब्लड ब्रेन बैरियर इज मेड अप ऑफ फैट, so this will not cross, whereas unconjugated bilirubin can easily pass the blood brain barrier leading to kernicterus. conjugated bilirubin जो रहता है वाटर soluble रहने के वजह से ये यूरिन में एक्सक्रीट होता है, तो अगर यूरिन में एक्सक्रीट हो रहा है bilirubin, so that should be conjugated, that should be water soluble, because unconjugated bilirubin वाटर यूरिन में एक्सक्रीट नहीं हो सकता क्योंकि वो वाटर soluble ही नहीं है, बिकॉज ये वाटर में soluble है, यूरिन से एक्सक्रीट होता है, this bilirubin is the one which will give urine the yellowish color. Okay, so this you have to remember the difference between conjugated and unconjugated hyperbilirubinemia. That there is bilirubin in the urine, it is not normal for an healthy individual. So if at all there is bilirubin which is present in the urine, that means you should understand that there could be some liver dysfunction or there could be some bile duct dysfunction which is causing bilirubin to be in the urine, and this bilirubin will be conjugated bilirubinemia. This bilirubin should be water soluble, then only it will be excreted in the urine. So what are the normal ranges? Usually we don't see any bilirubin in the urine, but whenever in the reagent strip we report it as small, moderate and large. That means whenever we say it as small, it is around 17 micromole per liter of bilirubin present. If it is large, it is more than 100 micromoles of bilirubins which are present per liter. What are the causes? Why do we get bilirubin in the urine? So one could be because there is impaired hepatic excretion. There is some problem in the liver. There could be hereditary disorders like Dubin-Johnson syndrome, Rotor syndrome, or there could be recurrent intrahepatic cholestasis, or there could be cholestatic jaundice of pregnancy. So all these inherent conditions can cause impaired hepatic excretion of this bilirubin, or else suppose if there is an viral hepatitis or drug induced cholestasis etc., then also the bilirubin whatever is there that may not be excreted properly from the liver. Suppose if there is an alcoholic liver disease, patient is having infection, sepsis, or he is having some kind of an operation, post-operative state, biliary cirrhosis etc., there can be bilirubin in the urine. The extrahepatic causes wherein there can be bilirubin are, suppose if there is an gallstone in the bile duct, so that time you can see that there could be conjugated hyperbilirubinemia. If there is a biliary malformation, if there is any infection in the bile duct, if there is a malignancy in the head of the pancreas or in the bile duct etc., or if there is pancreatitis, all these can cause increased bilirubin in the urine. So suppose if the urine analysis is positive for bilirubin, we will have to measure the total bilirubin and also the direct bilirubin. So when we get the comprehensive metabolic panel for this patient like the liver function test, and if we get increased total bilirubin and direct bilirubin, so this will show you direct bilirubin, that is conjugated hyperbilirubinemia. So we will also have to obtain the other liver function test, the liver enzyme AST, ALT, GGT, PT, APTT, the liver function test has to be obtained. We have to screen for if the patient is having viral hepatitis, because that can cause conjugated hyperbilirubinemia. Sometimes we might even have to screen for the autoimmune disorders, because autoimmune hepatitis also can lead to hyperbilirubinemia. Like in case of we have to do a ANA, ASMA, anti-LKM, anti-smooth muscle antibodies to see if there is any autoimmune causes for this hepatitis. Suppose if we do not get anything in this, we might also end up doing a ultrasound and CT scanning to see what are the what is the state of the biliary ducts. Is there any intrahepatic causes or is there any extrahepatic causes for this conjugated hyperbilirubinemia? So this is how do we approach a case of bilirubin when we see it in the urine. Remember, bilirubin is normally not seen in the urine. It's not a normal component which we see in the urine. If at all you see bilirubin in the urine, you have to suspect whether the liver is functioning properly or is there any bile duct anomaly. And how do we proceed to a case of hyperbilirubinemia, we will have to correlate with the liver function test. We might also have to do an extra additional testing like for autoimmune hepatitis, viral hepatitis, for his PT, for his APTT. We might even require an ultrasound. We might even require an MRCP, etc. to find out what exactly is the cause for this conjugated hyperbilirubinemia, which gets excreted in the urine, leading to bilirubin in the urine. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.